They're calling it the fourth wave, a new spike in the number of COVID cases that has health authorities on alert. Professor Peter Collignon's an infectious diseases physician and microbiologist, and I spoke to him a short time ago. Professor, thanks for your time. Hardly anybody wants to talk or worry about it anymore, but what do we need to know about this fourth wave?
Well, we need to know that COVID's still here, and there's quite a lot of people in Australia that seem to be infected, probably even 1 or 2% of all people, if you look at comparative figures from the UK. But it's also important to know that we're in a much better position now than we were a year and a half ago. Probably 80% of Australians have already had COVID over the last year, and after getting immunised and getting a natural infection, they have what we call hybrid immunity, which doesn't mean you can't get it a second time, but you're less likely, and if you do, the consequences are much less. So while we're seeing a lot of cases, and a lot of cases not being picked up, overall, your chance of dying or getting seriously into hospital is markedly less, at least 90% less than a year and a half ago, and that should continue. The vaccines to date, providing you've been up to date and you've had your boosters, particularly if you're over the age of 70, seem to be very good at markedly decreasing your risk of coming to grief. And your risk now of dying from COVID is about the same as influenza. The only difference is we have 4 or 5 waves over the last year instead of one wave, and that's why the severity of COVID on a population has been much worse than influenza because there's so many more waves. But that will change as time goes on. It'll become very likely, like influenza, something here every winter, and we won't be going through these summer and spring outbreaks.
So the concern here and now is if we get together for our Christmas events or to see our friends, it's looking out for vulnerable members of the community, is that right? People who might end up in hospital as a result of it.
Yes, and the most vulnerable are those over the age of 80 and 70 or people with underlying disease. So what's really important is to use common sense when you're around your family and friends. If you're sick, stay home, get tested if you can, with a rat test, keep away from others till you're better. If you can meet people outside, if they're vulnerable, that's better. Have a barbecue instead of an indoor dinner, because being outside decreases your risk by 95% or more. And some people should also wear masks if they're vulnerable and in crowded indoor situations. Masks probably decrease your chance of getting infection by 15 and 20%. Not huge, but it's still worth doing if you're a vulnerable person. So there's a lot of common sense things we should have always done, even for influenza, but it's more important now. But it still means you can meet people, you can have festivities. Just do it with people who aren't unwell, and as much as possible outside. Open the doors and windows and have fresh air coming in rather than air conditioning as well.
So if vulnerable people do contract the disease and have to go to hospital, what kind of rate will that be at, and will the health system be able to cope?
The health system does seem to have trouble coping at different times, but a big factor of that is we've got much less beds than 20, 30 years ago per 1,000 people. So it's the straw that's breaking the camel's back, and we need to address that, but we can't fix that for a number of years. So basically what we need is people who are vulnerable in particular, if they think they've got COVID, get a PCR test, because if it's positive, there are drugs that make a difference to your chance of dying or getting seriously ill, drops it further. And that's really important. You get tested, and for those people, they get antiviral medications very early, because all of that protects them. So do your best to not get infected, but if you're infected, and particularly if you're vulnerable, get tested early with a PCR test and access yourself to the antivirals that the Australian government makes available to all eligible people in a very timely way once you have that test result.
I've heard and I've seen on social media people worrying because their parents have become suddenly ill with COVID and not knowing how to get those antivirals, but you can actually get them with a telehealth appointment now, can't you, quite swiftly?
Well, you should be able to. Obviously, you need to do it through your own local doctor, but between telehealth and helplines that different state health departments have got, you should be able to get that medication fairly early. But what's important is if you think you've got COVID and you're over the age of 70 in particular, make sure you get a test. In this particular case, get a PCR test is better, because rat tests can sometimes be a couple of days before they're positive, because if you've got COVID and you're in that age group, then the antiviral medications decrease your risk further. The most important thing is to be vaccinated and ensure you've had boosters, but on top of that there's extra protection now that we didn't have a year and a half ago.
So if we've had 3 jabs, do we need to get a 4th one now?
Well, it depends on your age. If you're over the age of 70, yes, I think you need a fourth jab. But if you're a 20-year-old, the answer is probably not. Because if you've had 2 doses and you've had like 90% an infection, you've in fact had 3 exposures to the virus, and all the indications are that you have very good immunity that lasts to protect you against serious disease for quite a while. Unfortunately, the vaccines haven't worked as well as I thought they would, or others have hoped, in decreasing mild disease. They're probably only 30 or 40% effective. That's still better than nothing, but what they're very good at and have stayed very good at is decreasing markedly your risk of dying or getting seriously ill and ending up in hospital.
Professor, thank you.
Thank you.